Rebecca, let's talk about cervical screening, which many people still refer to as smear tests, which is fine because people know what we mean, but it actually doesn't really make sense because the technology's moved on. What used to happen is that cells would be removed from the cervix and smeared onto a slide to be examined under the microscope, but now a brush is used instead, and those cells go into a liquid solution and they're analysed that way. So people say smear test, but actually it's cervical screening. Can you tell us what a cervical screening is and who should be having them?
Cervical screening has evolved a little bit. So it now looks for whether you have any evidence of HPV in those cells taken from the cervix. And then only if you have evidence of HPV will it look to see if there are any of those precancerous changes that can occur as a result of the virus. It's really important because having HPV can be completely without symptoms. And so women may not necessarily know that they're at that increased risk of developing cancer. For that reason, cervical screening is offered to everybody with a cervix aged from between 25 to 64. And it's typically offered every 3 to 5 years, depends on your age and it depends where you live.
And what exactly happens when you go to have a cervical screening test done?
It's part of a national screening programme, so people will receive an automatic invitation. Typically happens at your GP practice where a GP or a nurse will do the actual screening. You'll be asked to come into a room. There'll often be a chaperone there because it is an intimate examination. You position yourself on the couch and you'll have to draw your knees up towards your belly and then flop legs apart. Try and stay as relaxed as possible. And then the practitioner will insert a speculum into the vagina, and that just helps to open up the vagina so that they can see the cervix. Once they can see the cervix, they insert a really soft plastic brush, which they use in a circular motion to collect that sample of cells. Those sample of cells can then be put into liquid and sent off to the laboratory. It takes about 5 to 10 minutes. I would say it's uncomfortable, but it shouldn't be painful. And you know, it's definitely something that, you know, I wouldn't want women to avoid because it's uncomfortable.
And sometimes it's likened to a wax, and a wax is definitely more painful. It takes longer, and actually it's more intimate as well. So anyone who's ever had a wax, don't be worried about having a cervical screening. Okay, so what can be the potential results then of a cervical screening, and what would happen next for each different outcome?
So broadly, the results fall into kind of 3 different categories. The first one is there's been no evidence of HPV. That means that you're at extremely low risk of developing cancer. And those people are just put back into the national screening programme. So they'll be invited back in 3 to 5 years. The second group will show some evidence of HPV in the sample of cells, but there'll be no abnormal cells, so no evidence of any precancerous or worrying changes in the cervix. Even if there has been HPV found, it still doesn't mean that you're definitely going to develop cancer. It just means that the risk is slightly higher.
And most people actually will not develop cancer.
Yeah, absolutely. So for those people, they'll be invited back on an annual basis to see whether the body has cleared the virus by itself or whether there's been any of those kind of more concerning changes to cells. If that does happen, then there's a more detailed examination that needs to happen, which is called colposcopy. The final group may have cells that both have HPV there and some of those precancerous changes. Again, those people will not definitely go on to develop cancer. It just means that the risk is slightly higher. And for that cohort of patients, they'll typically be referred for a colposcopy to get a closer look.
So what we're saying then is that cervical screening is our best defence against cervical cancer. People between the ages of 25 and 64 who have a cervix will be invited and should attend. And if you actually attend for each and every appointment you're invited to, the chances of you ever getting cervical cancer in the first place are extremely low.